we're gonna start with physiological flexions of the elbow. And the first mobilization is in grade 1 because she have a lot of pain. And pasa por aquí. We're gonna start pasa por aquí with flexion. Okay, small. Si sientes dolor me avisa, levanta la mano. Okay. ¿Cómo te sientes?
Bien.
¿No duele? All right. The second mobilization is the longitudinal of the radius. Grade 1 is a distraction in the radius, right? It's grade 1 too for pain and help in flexion too. And the third mobilization is the posterior-anterior glide of the head of the radius. It's a large amplitude in the middle of the arrow M. It's grade number 2. Okay? In the middle of the arrow M. It's for pain too, right? Alright, now we're gonna start. We're gonna follow with wrist movement, mobilization. The wrist is very stiff. But there is not pain. It's not too much pain. So I'm going to start with anterior-posterior glide of the carpals on the radius. Okay, so with grade 4. And to improve extension of the wrist, right? Grade 4. Okay. Now, I'm going to perform a posterior-anterior glide of the carpals on the radius with grade 4. Alright. ¿Cómo te sientes?
Bien.
Now, the third mobilization that we're gonna do is grade number 3, anterior-posterior rotation of the distal radioulnar joint, alright? To improve supination and movement in the wrist, okay? Grade number 3, to improve supination. All right. Now we're gonna do the same, the mobilization to shoulder. Okay. Lidia, vas a moverte hacia el lado de ella. Okay. Protégete. Aquí. Sí. We're gonna work with scapula, the inferior angle of the scapula. Okay. Vamos a poner la manita aquí. Okay. It's a scapulohumeral to improve movements in the humerus, and that's movement gives propioceptive input, all right, and help to relax the patient, all right. This lateral and medial rotation of the scapula, of the inferior angle of the scapula. Relájate. Relájate. Okay. This movement help movement in the shoulder. This scapulohumeral movement help in movement of the shoulder. Okay. Como te sientes? Bien. Next mobilization is longitudinal glide of the head of the humerus in the caudal direction, alright? We're going to start with grade 3, follow transition to grade 4. Alright? Relax. Grade 3 is a large amplitude at the end, large amplitude. Then the transition is grade 4, small at the end. Okay. Now, next mobilization is posterior-anterior of the humerus. We're gonna start with grade 4, and then transition to grade 3, alright? Grade 4. Grade 3 at the middle end of the range of motion. This mobilization helps to stretch capsule. Mobilization is a grade 2. It's a lateral glide of the humerus. This helps to external rotation. Okay. This movement helps to external rotation.